My name is Elizabeth Messenger. I'm the Director of Outreach and Education here at NeedyMeds. Just a few housekeeping things before we do get started with the webinar. This webinar will be recorded and available on our website as well as our YouTube page in the next probably week or so. So if you want to refer back to the video or for anyone else, it'll be on our website on our videos page as well as our YouTube page. You can contact me for a copy of the slides after the webinar. You should have already received an email with my contact information. You'll be receiving another email with my contact information if you would like to request a copy of the slides. We'll be happy to send those out for you. You will remain on listen-only mode for the duration of the webinar. If you have any questions at all during the presentation, go ahead and type those into your questions bar in your control panel, and we will do a question and answer at the end of the webinar. So again, anytime you think of any questions, you can type them in at any time during the webinar, and we will do some questions and answer at the end of the webinar. So I'm going to go ahead and introduce our panelists for today's webinar. We have Casey Quinlan. She's an author, speaker, and journalist whose work is focused on improving healthcare from the ground up. Her Amazon bestseller, Cancer for Christmas, Making the Most of a Daunting Gift, is a humor-packed guide to becoming your own patient advocate, and you can find her online at mightycasey.com and cancerforchristmas.com. We also have Jeannie Pinder here with us today. She's the founder and CEO of clearhealthcost.com, bringing transparency to the healthcare marketplace by telling people what stuff costs. Her team uses shoe leather reporting, data journalism, crowdsourcing, and other tools to reveal the mysteries of price. She was a reporter, editor, and HR exec at the New York Times for almost 25 years and has also worked at the Associated Press. So without further ado, I think we will get started. I believe Casey will be beginning today's webinar. If you want to take it over, Casey.
Yes, thank you, Elizabeth. It really is a pleasure to be here today. And this is a topic that is near and dear to my heart and also to Jeannie's. A little bit of context on why I ended up becoming a health price transparency advocate, evangelist, pick a word, is that at the end of cancer treatment, my insurance premiums went to a level that I said it was easier if I just didn't have insurance. But then I had to start finding out how things cost, what things cost before I bought. And it became sort of interesting, and I learned a lot in those 5 years. So today we'll be talking about trying to get at how much healthcare really costs. Now, the first question that you will be asking is, how do I find out costs? Well, it really seems almost simplistic, but really if you start with just asking how much is that, you'd be surprised. Sometimes you will get an answer. It will be easier, I think, with things like prescriptions, because usually at that point you're dealing with something that has, well, if it's not a fixed cost, at least it's a cost that more people know than not. And also if you have copays, there's, copay cards, there's a lot of other things that feed into it. But even on the medical practice, i.e. treatments, procedures, etc., office visits, lab tests, if you just ask how much is it, often you will get an answer. And if you get the answer that says, we don't know, well, you can go to CMSgov, which is the Centers for Medicare and Medicaid Services. They do have pricing information on their site, but it's a little bit harder to find than you'd think. You have to have some conversance with CPT codes or the codes that are in ICD-9 and soon to be ICD-10. You will be able to find out some stuff, but again, you'll have to know all the moving parts of a specific treatment to be able to get at numbers that might come close to your actual expense on something. Now, this is particularly critical for people that have high deductible insurance plans. And as of January 1st, that will include me. I'm going from uninsured to insured, but with a high deductible. So I will still be out there asking these questions myself. So I'm not telling anyone here to do anything I'm not already having to do for myself. Now, speaking of insurance, this is a graphic that has the logos of the larger insurance companies. Asking your insurer how much something's going to cost will get you that's proprietary information answer. Because what insurance does is they negotiate bulk-wise. In other words, say there's a large health system in your city. they will go and negotiate rates within that health system. Let's say it's HCA or Bon Secours or Kaiser. Well, Kaiser is its own insurance agency. But anyway, insurers will negotiate different rates even within, say, the same specialty, like oncology. One oncologist on Main Street might get a reimbursement amount, or that charge might be $150, and there's an oncologist that's over on Fifth Avenue that's getting $400, and it all comes down to how well they can negotiate, both the insurer side and the provider side. So it changes from provider to provider. It can change from plan to plan within the same insurer. So asking your insurer might get you some information, and I mean, it will get you information pertinent to your particular plan. But if you're trying to shop around for the best price for what you need, in some ways you might be better off on the cash market. But Jeannie will be talking about that later. Now, you can tell already that I'm talking about payers, I've talked about providers, and I've talked about patients, and then there's all the people behind the scenes, the great and powerful Oz's. And there's so many cooks in this. It really is something of an inedible price too when it comes to healthcare prices. So here's an example. Now, when I was getting cancer treatment back in 2008, this is actually one of my EOBs, explanations of benefit, from my insurer, which at the time was Anthem. And so when you look at this, which is the price? Obviously you start with provider charges, and that's $4,187. Okay, well, is that the price? Well, I don't know, because then in the next column you have network savings. Now that is the negotiation downward that the insurer has negotiated with this particular provider. So by being in network, the provider has agreed to take less money, but they're guaranteed that they will get payment because I was insured or someone is insured. So then the allowable charges drops from $4,187 to $2,200.10. But they still didn't pay because there's co-insurance. My co-insurance at the time was 20%, so I owed $440. But what is the price? I mean, at that point, if I went in and asked my oncologist, because this was, for chemo, if I went in and asked my oncologist, what would the cash price be on this treatment? Who knows which of these numbers might have shown up? And it might have been another number, a sixth one that we don't see here. Now, I do know that there are a number of stories out there, in major media about patients who have been quoted, they found out from their insurer that it was going to be, just using raw numbers, $250,000 to get that really big thing they needed. But if they negotiated a cash price, they could knock that down to under $100,000. But it does get very complex. And if something's going to cost $250,000, there's not just one piece in there. That's very complex treatment. So negotiating cash prices is something you want to start small. Start with your annual physical. Start with the meds that you take regularly, if you can. Start with some of the stuff that you know in advance you're going to need, and start negotiating cash prices or trying to work on the price, particularly if you have a high deductible plan. Now, there are places you can find prices without having to actually go to the source, the doctor first, or the hospital, etc. There are reliable sources like Clear Health Costs. Now, I am not in any way financially involved with Clear Health Costs. I just have gotten a lot of really good information from that website, even though I'm not in one of the cities that they are crowdsourcing actual pricing info for. Because as a sophisticated consumer of healthcare, if you know what you need and you can access the CPT codes, which are pretty easy to find online if you know where to look, and also you can look at your explanation of benefits from previous treatment if it's for the same thing. But also find a community. I mean, if it's just regular checkups for your kids, or you need a med, or what, you're going to have a community that you're talking to, and you can ask them. Ask the other moms, ask the other people who have that thing, whatever it is you have, what they're paying, and if they're in your same geographic area, that's a place to start your negotiation. Now, here's a question that Jeannie and I get asked a lot when we talk about asking how much is that, and the question is about emergency care. Am I supposed to bargain for my emergency appendectomy? Well, no. Obviously not. For emergent things, i.e. stuff that ends you up in the ER, things that are totally unexpected and end up having a large impact financially, you want to go in and you want to get the care and then negotiate the billing afterwards. But also, again, going back to what I've said so far, if you know where to find pricing information in your geographical area, if you know how to identify what the rates are that have been negotiated with that payer by insurers, then maybe you can, and find out if they'll work with you. But the more information you can take into that negotiation, the better off you're going to be. Now, the big ticket items, as I was mentioning before, the thing that costs $250,000, that number, the $250,000, sticks in my head because that is typically what a full-on hip replacement, including all the rehab and, et cetera, everything from, oh my Lord, I need a hip replacement, to I'm walking now away from the physical therapist and I'm all good. That's about $250,000 round numbers most places in the United States. Sometimes you can get it for less. But anyway, $250,000. Oh, and by the way, my cancer treatment, full stop, the price for the whole thing without insurance or whatever would have been $250,000. So you can ask. You can knock that $250,000 down if you negotiate prices ahead of time, be it for chemo drugs or for appliances, or you could do, there's a terrific article in the New York Times about a guy named Michael Chopin who went to Belgium to get his hip replacement and saved himself somewhere in the neighborhood of $120,000. And that was a medical tourism place. So ask, crowdsource price information from your network, and consider medical tourism. There are tourism agencies that do exactly that. They help people figure out how to, where to go. They have nurses and doctors on their staff. I'm going to excuse myself for a moment here. I'm having a dust coughing attack. Sorry. It happens when the heat's on. So you crowdsource price information from your network, consider medical tourism, find a tourist bureau, and you can do that by just Googling medical tourism. Excuse me again, coughing. I apologize. I'm sitting here drinking water and it's not helping. But this three-pronged approach with asking, crowdsourcing price information, and considering medical tourism is a terrific way to get at least knocked down on some of the big ticket items that you might need help with. So bottom line, when you learn a price, share it. Oh, and I forgot the H in lather. Well, anyway, lather, rinse, repeat. Not later, but we'll fix that before the slides get shared. But crowdsource information, and when you know something, share it. Every time I pay a cash price for healthcare, anywhere where I go, I tweet it. People know to look for me because I've become one of the louder voices in healthcare price transparency. And Jeannie and I run a tweet chat on first and third Mondays of every month on the hashtag HCPT. So if you're on Twitter and you want to hear from people who are literally doing this in real time or who have ideas on how to help, then you can join us on a Monday night at 8 o'clock Eastern Time, first or third Monday. And I believe that it is now time for me to rescind control and let Elizabeth hand it off to Jeannie.
Thank you, Casey. We are going to go ahead and pass it on to Jeannie, and while we're doing that, we're going to do a quick poll. So let's go ahead and run that poll. You all could just respond. I want to keep everyone active here. So, how would you like to find out RX pricing for your medications? Please select one of the following: your pharmacist, doctor, insurer, or from your pharmaceutical company. So please go ahead and start responding. Just want to make sure everyone's still awake there.
Oh, sorry, did I put them to sleep?
No, not at all.
Did I put them to sleep?
Okay, we'll give everyone just another second. And we'll go ahead and close the poll. So it looks like people are hoping to find out information from their pharmacist. We have 45%, 29% from their doctor, 16% from their insurer, and 9% from their pharmaceutical company. So seems like the general gist is people want to find out from their pharmacist. Jeannie, how are you doing there?
Oh, good.
So whenever you're ready, you can go ahead and start your portion of the presentation.
I didn't get the invitation from you to show my screen. I don't. Oh, yes, I did. Sorry.
You're showing it.
Okay.
We'll just get to your slide, and then we'll be all set.
So,
okay, there you go. So without further ado, we're going to have Jeannie Pinder finish up the webinar.
So we hear a lot from people who are asking, can I really negotiate prices with my doctors? Not everybody is comfortable with this, and I have to tell you that I've had my moments, some good and some bad. We find that there are a few things to know about negotiating prices with your doctors. First off, get as much information as you can first. We do, shameless actual self-promotion. We have some great information over at clearhealthcost.com, and we try to do what you would call shoppable procedures for our major pricing surveys. So, for example, if you don't want to negotiate your emergency appendectomy, you might be confident with negotiating over the price of an MRI because it's more like a kind of a commodity. So you get as much information as you can. Maybe you want to get the Medicare price, which we can also show you on our website once you have the CPT code, as Casey referred to it. Some doctors and hospitals post prices, but those Medicare prices really are the closest thing to a fixed or benchmark price in this marketplace. The more information you have, the easier it is to ask. You might feel uncomfortable about having that conversation, but it might be that you won't and that you'll learn something, and you truly will not know if you can negotiate price with your doctors until you ask. We do hear a lot from people who are asking these days, what is the cash or self-pay price, even if they're insured. We did a crowdsourcing project on the price of mammograms with our local public radio station, and we heard from people who said, we always ask for the cash price, and found out that they could get their mammogram for $200 rather than the billed price of $1,100. People who are extremely comfortable with this. What if your doctor can't or won't tell you what something costs? Well, we're actually pretty sympathetic to that. We kind of hope and believe that our doctors really understand the mysteries of the human body, but understanding the mysteries of the healthcare pricing marketplace is something that's not given to many of us, including me. So if your doctor doesn't know a price, I feel like that's probably okay, and it's not too unusual. The way the system has been constructed, it sort of rewards providers for setting a sort of an aspirational price, like a rack rate at a hotel or a manufacturer's suggested retail price. The provider may not even know in a granular level exactly what the insurance company is paying. So if your doctor can't tell you what something costs, don't feel alone. There's a lot of that going on. We have, although, heard that people increasingly are asking for those cash prices, so there's a growing awareness of this in the medical community. We also hear quite often that people are curious about this in-network, out-of-network dance. Like, let's say you go in for a procedure that's been long scheduled, like this happened on my colonoscopy, and after the fact, you find out that you had an out-of-network anesthesiologist. You have to know before you go, and in most cases, they will be able to tell you. In some cases, they can't. But what we always recommend is that you ask in advance so that you can avoid getting that gotcha bill on the back end. It's a little bit of extra work on the front end. Get it in writing. Are all the providers in network? Is the lab in network? The anesthesiologist? Take names, take phone numbers, get it in writing. And then if you are going out of network, which happens increasingly, we've all heard of narrow networks, right? Or doctors who have stopped, doctors, hospitals, providers who stopped taking insurance, period. If you're going out of network, you can always ask for a cash or self-pay rate. So that's the formulation that we use. Not how much is this going to cost, but ask for the cash or self-pay rate. Ask to pay in advance. Ask for a prompt pay discount. Are there any other discounts? We also hear a lot about saving on prescriptions by people who are curious about why the prices of their medications can vary a lot. It's on the formulary, it's off the formulary, it's tier 1. Last month it was $4, this month it's $54. So with medications, it's a little bit easier to extract savings from the system as we understand it, perhaps because this is more like a commodity. It's not exactly like buying a tomato at the grocery store, but it's a little bit easier to say, this is a pack of pills, can I pay this price for it or that price? We often hear again that people are asking for a cash or self-pay price, not invoking their insurance. One of my friends told me the other day that one of her medications cost a $20 copay, and on top of her insurance premium. But if she went to her local big box store, she could buy that same prescription for $8.90 without invoking her insurance on cash. So sometimes the smartest thing you can do for your medications is to put away that insurance card. We've also heard that people will ask pharmacists to match somebody else's price, and that can actually bear fruit. We recommend that people keep records of what they are taking or what they have taken, and to ask at the pharmacy counter. If a price goes up suddenly, you can ask if there is an alternative, because sometimes there isn't. Sometimes that alternative acts just as well, and it can be less expensive. Finally, we urge people to understand that all generics are not less expensive. We've heard a lot about generic prices bouncing all over the place. There's ample documentation of this on our websites. It's a really surprising thing because we all grew up believing that brand name drugs are more expensive, generics are less expensive. So if somebody offers you a generic, you're likely to think it's going to be less expensive. Don't believe it every time. Ask. Always ask what stuff will cost. And then we hear a lot from people who, after the fact, want to know if we have any advice about arguing about bills or challenging bills or reducing bills after the fact. This is a tough one. It's always easier to get your savings up front, get something in writing that you paid a cash or self-pay price, that you're getting a prompt payment discount. If you do find yourself in the unfortunate position of wanting to argue about a bill after the fact, these are a few handy tips. Check the bill carefully. Make sure that you have procedure codes. Check for things that were done or were not done. Something like 80% of all hospital bills have mistakes in them. And quite often it's not necessarily a matter of the hospital being evil, it's just complicated. That you should check that bill carefully to make sure that everything was done, that it was done on the date that it was done. Then you can use pricing guides to establish real charges. Once again, take ownership, get knowledge, and deploy that knowledge. When you're challenging a bill, you need to talk to real people, take notes, take names, take phone numbers, and have a file so that you can keep a running record of who you've talked to and what you've talked to them about. If you happen to be on an employer-sponsored health care plan, you could bring in your HR department. Sometimes they will have somebody who, as a care advocate even, will argue for you. Send letters and keep copies. CC everybody in the world and keep that in your file. And then finally, if you do find yourself in a position to feel that you would benefit from hiring one of the many professional services that are out there that will offer to challenge bills for you and reap benefits for you, we suggest that people shop carefully. There are many services like this. Some are better than others. You need to be really comfortable with who it is that you're going to be working with. And that's our best advice about arguing about bills. Finally, we're coming to the end of our formal presentation. We wanted to make sure that you had our email addresses and that you would be cheerful and happy to ask us any kind of question that you want to ask by email. We've really enjoyed presenting and meeting you, and want to thank you very much for your time and attention. And now we would love to hear questions.
Thank you so much. So yes, please do go ahead and type any questions you have for Jeannie or Casey, as they'll be happy to answer them. And then just a couple more things to mention in case any of you joined late. We will have a recording of this webinar available on our YouTube page as well as our video page on our website, so you can check that out. You can email me for a copy of the slides. My name's Elizabeth Messenger, and I'm the Director of Outreach and Education here at NeedyMeds. You should have already received an email with my contact information, but you will be receiving another email with my contact information if you do want a copy of the slides or if you have any NeedyMeds related questions. So we'll go ahead and start answering any questions you all have. So again, you want to type them into your questions bar in your control panel. Let's go ahead and check it out. So we actually have a NeedyMeds question. It's a question about what the average savings are using our discount card. And the average savings are about 45%, ranging anywhere from 0 to 80% off the cash price. So if you do want to use our card, those are the savings. And we're always looking here at NeedyMeds to share all different kinds of ways you can save on your healthcare and medications costs, which is why we are really excited to have Casey and Jeannie here presenting to us about other ways to save and how to really understand what your healthcare costs really cost. So let's see if we have any other questions. So here's a question, Casey or Jeannie, if you want to take it. Do you have an idea of what percentage of people actually negotiate for medical costs, how often this actually happens?
This is Jeannie. I can take that one. There are no firm numbers on that, but anecdotally, I can tell you over the 3 years that I've been doing this, we're hearing a lot of people talking about it. I think it's a function of the fact that more and more people are on high deductible plans. More and more people are uninsured, partly as a result of the sag in the economy. It's also sort of a geographically focused thing. We hear a lot of negotiating over prices in Texas, where there are a lot of uninsured people. And also here in New York, we hear a lot about that. I hear less about negotiating over prices in Iowa, where I'm from and where members of my family live. So it kind of depends. It also depends on what procedure or what item you're talking about. Prescription medications, we hear a lot of people who are price shopping actively, bargaining over prices, asking pharmacists. We've heard some of that too, although less.
Okay. And Jeannie, do you maybe want to just leave up your contact information, that slide, in case anyone wants it?
Oh, okay.
Okay. Let's go to another question. So someone was trying to challenge a lab bill, and they would not give them the negotiated price with the insurance. They said that they didn't negotiate. So do you have any tips for them, any suggestions of what they should do next for a lab bill?
Yeah, on a lab bill, typically we recommend that people, if they are going in for a lab test, make sure that they talk with their provider and know that it is something that will be covered by their insurance plan. If they happen to be uninsured or they're not covered, we recommend that people ask in advance, can I have the cash or self-pay rate? After the fact, it's a little bit harder to negotiate, but I've had success with doing things like searching any of the pricing resources that we gave, finding online Medicare reimburses $7.41 for this in Virginia. There are a lot of resources out there that you can use, and by showing actual real-life comparative information to a provider and being persistent, you can often get relief. Not every time. I would be happy to talk about this offline if you want to send me an email, and we could walk through the some specifics if you'd like.
Yeah, Casey talking here. Both Jeannie and I have a lot of information, specific information about ways to get at different, with labs. Obviously, the NeedyMeds folks also have a pretty good prescription thing, but both Jeannie and I have pretty good specific information on how to attack a problem. So if you want to get in touch with us, we can give you some step-by-step advice if you need it.
Right, and as Casey and Jeannie mentioned, if you're needing some help, with your healthcare medication costs, you can also always call us as well, and we can help you as well or try to help you. So one question: someone works with the elderly who may not be comfortable using the internet or doing this kind of work themselves. Do you have any suggestions for care advocate programs that could help elderly?
Well, Casey here. I would recommend getting in touch with any local CSB, Community Service Board. If you just, hang on a sec. I am myself Googling this just to make sure that I'm not telling you something that, board. Okay. CSBs, Community Service Boards, are local, and they're run usually by the state, sometimes usually by the state. But community service boards are places where people can go to get information on access to a variety of services, from mental health to physical health to elder health. And also, as goofy as it might sound, you could try Medicare, asking them who the best contact CSB, either at the CSB or at another agency in that geographic area would be. Because there are resources available. It might take some phone calling, but I would, and also if the person's in a nursing home, this is going to be less of an issue. But if they're aging in place or aging at home, usually there'll be some family member, and that was me in my family when my parents were still alive. But I got really good at just, finding out information. So if somebody has a question about that, they could get in touch with me, and I'd be able to hook them up.
I might also suggest your local SHIP or SHINE offices. So those are the groups around the country that do help seniors kind of navigate health insurance and other health costs. And you can actually search for those locally on our NeedyMeds website if you want to try to find your local SHIP or SHINE office.
And there's also the Patient Advocate Foundation.
Yeah, there are a lot of groups out there. So you can contact Casey or Jeannie. You can contact NeedyMeds. We'll try to direct you. Okay, so here's a question. Have you heard anything about an app that doctors are using to look up prices of medications now on their phones?
Well, yeah, I think that's Hippocrates. That's part of Athena Health's EHR landscape. And I do believe, Jeannie, do you know anything about Hippocrates? I think Hippocrates is the app that people can use on their phone. That doctors can use on their phone, and I think it might have pricing information, but I could be wrong.
I don't know that much about that, but there are a number of websites out there that will give you pricing information on medication. I'm sure you know there's GoodRx, WRX.org. They're springing up all over the place, and many of them will actually offer you a coupon. So their business model tends to be, we'll reveal prices to you, you need to use this coupon, and then there's a revenue split between the website, say GoodRx.org, and the provider or somebody else, so that you can actually see a price before you go in. We do recommend, though, that people be aware that those websites do not necessarily offer the lowest prices. In our experience, there's transparency, and some of them are really good prices, but there can also be much lower prices. So there's increasingly a lot of pricing information about medications that's out there and available.
Okay, so someone, I can't remember which of you mentioned the 80% errors in medical bills at hospital. Is that actually a figure that is it anecdotal, or do you actually have read somewhere, or is that research findings that it's 80% of those bills are wrong?
Different things. I've heard 60%, I've heard 80%, and then I have a business acquaintance who analyzes hospital bills for a living, and he says 100%.
Okay. Okay then. So it looks like there's a good chance they might be slightly off if you want to look through them.
Right.
So here's another question. Is it possible for patients to negotiate a reduced rate in conjunction with a monthly payment if someone cannot pay the lump sum up front? Do you hear a lot about that?
We have heard a lot about that, yeah. And particularly, it can be either before the fact or after the fact. It depends. It's institution by institution. Not every provider, be it a hospital, a doctor, or a device maker, whatever, has a program like that. Elizabeth, you guys might know more about that than we do. We've heard a lot anecdotally about that, but I don't know if
I would say we also hear it anecdotally. So, I mean, I think it definitely does happen, and I think people will work with you. The hospitals will work with you if you cannot pay a lump sum.
Well, this is Casey here. I am of the school of thought that it's always best to go in saying, I'm probably going to need some help with this. Can you help me out? And I don't mean, help either understanding. Both Jeannie and I are members of the Society for Participatory Medicine, and I look at that participatory medicine thing as also economically participating. In other words, I want to make sure that my doctor doesn't feel as though he or she is being, hammered, but I also know that doctors want to help their patients and not necessarily hammer them economically. And I think that there's an opportunity here for us to move the whole game forward just by asking and going in and saying, okay, I'm going to need some help with this. Let's talk.
Yeah, and I think this is sort of a general thing. It never hurts to ask. That's something we always tell people who call asking about accessing the pharmaceutical patient assistance programs we list on our website. If they think they might not qualify or they're just sort of over an eligibility guideline, always call and ask, because a lot of programs, providers, people make exceptions for various hardships. So it certainly can't hurt to ask.
Yeah, I mean, if you make $1 million a year and you're going in and you're trying to, hammer somebody on a $4 prescription, I wouldn't advise that. But I don't think anybody on this call falls into that category.
So here's a question, and we've been getting this a lot too. So how do you think the Affordable Care Act is going to affect, negotiating prices and a lot of what we've talked about today?
I'd love to take this one. It's Jeannie. Right before I got on this webinar, I got a call from a representative in a billing office in a doctor's office not far from here, who's really apprehensive about what's going to happen with the Affordable Care Act. Many people on high deductible plans feeling that they're going to be asked for, patients will be asked for cash up front that they're unaccustomed to paying, having previously been on a $20 copay plan. Many of the networks that are being sold via the Affordable Care Act are narrower networks than what people have been accustomed to. So I think there's going to be a lot more turmoil in the marketplace now, and I think that there's also going to be both opportunities for people to negotiate bills by offering cash up front, and a lot of really stressed out people in billing offices. I just, I could hear the tension in her voice when she called, that she was not looking forward to January 1st. And I think it behooves all of us to remember as we set forth on this path that we're all in it together, that there's no one particular villain. People have often asked me, well, who's the bad guy here? It's the providers, right? Or it's the insurance companies, right? Or, oh, it's the patients. They're asking for all of that extra health care. The patients is the biggest driver of medical costs. The villain is the system. The system that we have built doesn't serve anybody well. And I think we're going to see a lot more stress and a lot more change before we achieve something that works well for everybody. So as we set forth on this path, I just urge everybody on this call and everywhere else to remember that the people that you're dealing with are not the enemy. It's the system.
It's a good lesson. I think we have time for just one more question. This is sort of a practical question. How far in advance do you suggest people negotiate for a medical procedure with their doctor and insurance company before the procedure?
As Jeannie, as far in advance as possible.
Okay.
Because you might find yourself choosing a different provider For example, that knee replacement, there is a surgery center in Oklahoma that posts prices online. You might decide you want to fly to Oklahoma. You might decide you want to go to Belgium, like the guy that Casey referred to in the New York Times story. Get your ducks lined up early. It'll help.
Mm-hmm.
Casey, you have anything to add?
No, I don't. Ask early, ask often, and keep moving the game forward. We're all in this together.
Okay. Well, I think that's about all the time we have. If we didn't get to any one of your questions, we'll try to get back to you after the webinar, and I hope this was helpful for all of you. As I mentioned before, here at NeedyMeds, we're always trying to share different resources and ways that you can save on your medications and healthcare costs and tools and tips. So hopefully this was helpful for you. You can always contact me for any questions about NeedyMeds. You have Casey and Jeannie's contact information there, and again, you will be getting a follow-up email with my contact information. So please check back to our website next year in January for upcoming webinars. We schedule these webinars pretty regularly, and they're always free. So feel free to sign up for future webinars, and I hope everyone has a very good day, and thank you for attending.